Most people hear herniated disc and picture dramatic pain, a ruined back, maybe surgery, but the real danger is quieter. The symptoms that steal function first, the ones you shrug off because you can still walk, still work, still push through. That is exactly what this video is about, herniated disc symptoms you should never ignore. Not every backache is a crisis, but certain warning signs are your nervous system waving a flare gun. Miss them, and you can trade a fixable problem for permanent nerve damage. So stay with this, because in the next few minutes you'll learn the difference between normal pain that heals and red flag symptoms that demand action.
All right, Dr. Ace here, and let's set the rules so you don't panic over every twinge. Herniated discs are common, and most cases improve without surgery. That's the boring good news. The useful part is this: back pain alone is not the main danger. What matters is what comes with it. A disc can bulge, irritate tissue, even hurt like crazy, and still heal with conservative care. But when a disc presses the wrong nerve in the wrong way, you can start losing sensation, losing strength, or losing control of things you really, really want to keep control of. So today we're not doing a giant list of random symptoms. We're focusing on the handful that signal serious nerve compression, plus a quick "don't freak out" section, so you can stay calm and smart.
Long before MRI machines and fancy spine clinics, people still had the same problem, a vulnerable column of bones protecting a priceless cable of nerves. When that cable gets squeezed, the message to your muscles and organs becomes distorted. Sometimes it screams as pain, sometimes it whispers as numbness, and sometimes it fails as weakness. The tragedy is that humans are trained to react to loud alarms, not quiet malfunctions. Pain gets attention, loss of function gets ignored, and in the story of disc injuries, the quiet chapter is often the one that matters most.
Your spine is stacked bones, and between those bones are discs, like shock absorbers. Each disc has a tougher outer ring and a softer gel center. When people say slipped disc, it doesn't mean the disc shoots out like a bar of soap. It's more like the outer ring tears and the inner gel bulges out through a weak spot, kind of like toothpaste squeezing out when the tube cracks. If that bulge touches a nerve root, that's when the classic symptoms start. Lower back discs can irritate nerves that go down the leg. Hello, sciatica. Neck discs can irritate nerves that go into the shoulder, arm, and hand. And here's the key. You can even have a herniated disc and barely feel it if no nerve is being compressed. That's why symptoms matter more than the label.
And now, the moment where the music changes, because the spine does not care if you are busy. Nerves do not wait for your schedule to clear. A red flag symptom is not pain that is annoying. A red flag symptom is a sign that nerve function is being lost, and time begins to matter. In the old radio dramas, this is where the narrator leans in and says, "Pay attention, because the next details could change the ending."
Red flag number 1, progressive weakness in one arm or one leg. Not, "I felt tired today." I mean, you notice you're losing strength over days or even hours. You start tripping because your foot won't lift normally. Your toes catch the ground. You can't walk on your heels, or you can't push off on your toes. In the arm, you start dropping objects, your grip feels unreliable, buttons become weirdly difficult. Why it's concerning? Weakness means motor nerve signals are getting choked. If that compression continues, the nerve can go from irritated to injured. Clinically, this can show up as things like foot drop, and the longer true weakness sits there, the harder it can be to fully reverse. Pain can be dramatic and still recover. Weakness is the symptom that makes doctors sit up straight.
Imagine a garden hose being stepped on. At first, the flow sputters. Step harder, and the flow fades. That is what nerve compression does to movement. Muscles do not suddenly forget their job for fun. When strength fades, the wiring is being compromised. And the cruel twist is that people often adapt. They limp, they compensate, they call it aging, they call it stress. Meanwhile, the clock keeps ticking.
Red flag number 2, numbness or tingling that spreads, persists, or clearly worsens. A little pins and needles that goes away after you change position is annoying but common. What you should not ignore is numbness that sticks around, expands, or turns into true loss of sensation, like it started in a few toes and now the whole foot feels asleep, or it began in 2 fingers and now the whole hand feels off. That pattern often follows the path of a specific nerve root. Why it matters: sensory fibers under constant pressure can get damaged. And here's the trap: numbness is quieter than pain, so people tolerate it. They keep training, keep working, keep pretending it's fine. If numbness is progressing, treat it as a warning, not a personality trait. Especially when numbness teams up with weakness, that combo is a neon sign saying nerve function is deteriorating.
In a clinic, the story often continues with a simple test: a tap below the kneecap, a flick at the ankle, a reflex that should appear like a familiar echo. When it does not, the body is giving away the truth. Loss of reflexes is the nervous system admitting something is blocked. The audience at home may not test reflexes, but the lesson is clear. The body can show objective signs of nerve compromise before the situation becomes irreversible.
Red flag number 3, sharp, radiating nerve pain that is intense, disabling, or not letting up. Not all pain is equal. Local back pain can be muscular, joint-related, or disc-related without severe nerve injury. But when pain shoots like electricity down one leg or from the neck into the arm, following a line, that's a nerve being irritated. Now, radiating pain alone doesn't always mean emergency, but here's what makes it a red flag. It's severe, it's constant, it's escalating, and it's paired with neurological changes like numbness or weakness. If you can barely walk because every step triggers a lightning bolt, or you cannot use your arm because the pain is hijacking everything, you need evaluation. Uncontrolled nerve pain can signal significant compression or inflammation that may need more than wait it out.
And now comes the chapter that every spine specialist treats like a fire alarm, the kind of symptom that turns a clinic visit into an urgent trip. In old terms, the point of no return. It involves systems people are embarrassed to mention, which is exactly why they delay. But embarrassment is a terrible trade for permanent damage. So here it is, plainly, without drama, because the seriousness creates its own gravity.
If you suddenly cannot control urination or bowel movements, or you cannot start urinating, or you feel numbness in the groin, inner thighs, or the area that would touch a saddle, that can signal guarda equina syndrome, where a large disc herniation compresses the nerve bundle that controls those functions. That's not watch and wait, that's go now. Also, red flag, weakness in both legs, severe unsteadiness or coordination suddenly falling apart, especially if it's paired with those sensory changes. Most disc problems affect one side. When both sides are involved, think central compression. Bottom line, new bladder or bowel dysfunction, saddle numbness, rapidly worsening weakness, or inability to walk steadily are urgent signs. Do not negotiate with those symptoms.
After a list like that, the mind tends to spiral. Every ache becomes suspicious. Every tingle becomes a prophecy. But wisdom is not fear. Wisdom is sorting signal from noise. The next segment matters because it stops you from overreacting while still respecting the red flags. In other words, stay calm, but stay awake.
Let's talk about common symptoms that feel scary but usually are not emergencies by themselves. Localized back pain without major radiating symptoms is extremely common, even with disc issues. Muscle stiffness and spasms can be brutal, but they're often your body's protective guarding, not nerve death. Pain that improves with gentle movement or position changes can actually be reassuring, because severe nerve compromise often feels relentless. And mild, intermittent tingling that comes and goes and improves over time is typically not an emergency, as long as it is not trending worse. Also, if your symptoms improve with basic steps like brief rest, anti-inflammatory medication, and guided movement, that's a good sign. The key distinction is trend and function. Is sensation fading over time? Is strength declining? Is control changing? Pain can be loud and still recover, but if function is slipping, that's when you stop treating this like a normal back flare.
Denial speaks in comforting phrases. It's just posture. Determination adds bravado. I can power through. Medication supplies a mask. If the pain is gone, the problem is gone. Fear closes the door entirely. If I don't check, it isn't real. And the final villain is ignorance, not stupidity, just lack of a map. People worry about the wrong symptom and dismiss the right one. That is why this story repeats year after year in every country, in every age group.
Practical stuff that can make a herniated disc worse and what to do instead. First, repeated forward bending under load, especially with twisting, is a classic way to aggravate a disc. If you're lifting, keep the spine neutral. Use the hips and legs, and avoid repeated rounded back chores for long stretches. Second, too much rest can backfire. A short break during a flare is fine, but prolonged bed rest stiffens you and weakens support muscles. Gentle walking and guided rehab usually beat total shutdown. Third, do not train through nerve symptoms. If you have sharp radiating pain, worsening numbness, or any weakness, you modify activity immediately. Fourth, fix the boring stuff, posture and ergonomics. Long sitting with a slumped spine is gasoline on irritation. Take breaks and support the lumbar curve. And yes, lifestyle matters too. Smoking and poor recovery habits can slow healing. The goal is not to become fragile. The goal is to move intelligently while the nerve calms down.
So when should a person seek help? The rules can be simple, and simplicity saves lives. Go immediately for new bladder or bowel dysfunction, saddle region numbness, rapidly worsening weakness, or legs that cannot reliably carry you. Seek prompt evaluation when numbness spreads, weakness appears, coordination worsens, or symptoms trend downward instead of upward. And for the non-emergency crowd, if pain or sciatica persists beyond about 4 to 6 weeks despite proper conservative care, that is a reasonable line in the sand to get assessed, not out of panic, but out of strategy.
Now, the hopeful part. A herniated disc is not a life sentence. Many people recover fully and return to training, work, and normal life, sometimes smarter and stronger because they rebuild properly. Your spine likes stability. That means gradually strengthening core and hip support, restoring mobility, and practicing clean movement patterns. Think walking, controlled rehab exercises, and eventually progressive strength work with good form. The goal is not to fear movement forever. The goal is to earn movement back. Also, remember the mindset shift. You're not hunting for pain elimination at all costs. You're tracking function and trend. Are you getting stronger? Is sensation returning? Is control normal? That's the win. And if you want, the next video can go deep on safe strengthening after a disc flare, what to do, what to avoid, and how to return to lifting without turning your spine into a recurring drama series.
Let the final message be carved into memory. Herniated disc. Symptoms you should never ignore are the ones that signal nerve function is being lost, progressive weakness, spreading numbness, severe disabling nerve pain with neurological changes, and especially bladder or bowel changes with saddle numbness. Most back pain is loud and recoverable. The dangerous cases are often quiet, until they are not. Share this with the person who keeps toughing it out. And if you're the one toughing it out, remember, seeking help early is not weakness, it is precision. The strongest move is the smart move.